Working through frustration when tapering off medication. In this telehealth session, a counselor and client discuss how to manage expectations and frustrations when tapering off sublingual or extended release buprenorphine.
I've been trying to taper for a long time and it just feels like it's like never gonna happen. I keep experiencing terrible withdrawal symptoms every time I lower the dose and I need to go back up on dosage. I just can't afford to feel lousy. I need to work to function and for my family and myself, but I really want to come off the medication.
I can understand your frustration. Coming off these medications can be frustrating and unpleasant and really disrupt your life.
Yeah, it's been really hard.
But I also want you to know that you always have the option to stay on the medication. It's your choice.
That's true, but if I still do want to get off it, what can I do?
Some things to consider. The slower you taper, the smoother the transition. Think about getting down off the top of a mountain. If you take a long, winding path, it's slower but safer and easier on your body, right?
Right.
Slowing the taper down can help with cravings and withdrawal. Once those two things are controlled, you're set up for better success.
It sounds great, but how long is this going to take?
Be patient with yourself in coming off the medication. It took months or years for your body to get used to using opioids every day. So take your time as your body gets back to normal. Trust the process.
It seems like I get sick even when we make the smallest change in dose.
I understand. It may not be possible to avoid some unpleasant feelings during the taper. If you feel symptoms, try to remind yourself that you only need to get through this once. The symptoms won't last forever, and it may be worth feeling bad for a while if coming off the medication is really something you want. Think about a marathon runner making a final push for the last few miles. It's unpleasant, but worth it.
Yeah.
And finally, like I mentioned before, if it really isn't working for you, you don't have to discontinue to please other people. It's always an option to stay on the medication. And that's something that we can discuss more next session. Until then, be patient with yourself.
Thank you. I'll try to keep that in mind.